Hi, this is Sarah McClellan from Pixels and Pills, and we're at the Multi-Channel Pharma Marketing event. I'm standing here with keynote speaker, Mr. David Stern, who's from EMD Serono. How are you?
Excellent. Thanks, Sarah. How about you?
I'm very good. We enjoyed your speech this morning. I wanted to talk to you or ask you a little bit about what exactly you do at EMD.
I'm in charge of the Endocrinology business unit, which means I have all the commercial responsibilities for the U.S. for our endocrinology products. We make products in HIV, reproductive health, and growth deficiency.
Okay. You spoke a little bit in your speech about taking ideas not only from the top but also from the bottom. I wanted you to explain that a little bit further for us.
I think one of the things that is important within any marketing organization or any organization in general is we can't think that we at the top and the executive level have all the ideas or have the only opinion that matters. And I think oftentimes it's the ideas that come from the field, from the physicians' offices that understand what are the dynamics in the day-to-day environment that can really make a difference. So one of the things I think is critical is that we have active participation and dialogue. We involve our sales representatives and our marketing product management team together on teams that meet regularly so we can flush out ideas together and ensure that if we're going to invest in something, that it can be utilized by the representatives in the field and can deliver the most value to the patient.
And what do you consider to be success within a marketing platform?
I think success is one, utilization. So it's got to be utilized. And I think at the end of the day, one of the dynamics that we have in the marketplace within any biopharmaceutical is it has to be prescribed by a physician. And so if you can correlate the tactic to the response of the physician prescribing, and if you can look at a control group who doesn't receive the tactic and then identify the physicians that do get the tactic, and you see an increase in their prescribing, then you know that the tactic has worked.
Right. While you're here at the event, is there anyone in particular you're looking forward to hearing speak, or anyone that you're catching up with that you think is going to be really beneficial and will bring you success from this event?
Well, Jack Barrett, who's the CEO of We Go Health, and I go back many, many years. And in fact, Jack was at my first ePharma conference talk probably 10 years ago. And we've been working together as partners in the pharmaceutical marketing space for literally 10 to 11 years. So it's always nice to see Jack and catch up with him. I think what I like about these conferences is hearing what companies are doing that have been successful and really learning about what's different, because you can always take one or two good ideas away and then have it impact some of the things that you're doing.
So was there anything else from your speech that you wanted people to sort of walk away with?
Sarah, I think one of the dynamics that we as a biopharmaceutical industry have is the ability to educate patients and provide good quality education. Oftentimes, the reason patients stop taking their pills is because they don't understand that the side effects mean the drug is working. And in our dynamic today, the doctor doesn't have time to discuss it with them, and oftentimes the pharmacist doesn't either. So the patient never finds out what is normal to experience, and when they take a pill, which is maybe reducing their cholesterol or blood pressure, they can't see that effect, but they can see the side effect. And so they think maybe there's something wrong, maybe the pill isn't working well, but in fact, oftentimes it means that the pill is working, and nobody's ever really discussed that with them. So I think how we can provide value into the overall healthcare industry is by doing good quality education so patients understand their disease state, understand why they're taking a product that the physician has prescribed, and then understand the best way to take that product.
Fantastic. Yeah. Fantastic. Well, thank you so much for speaking with us today. This is Sarah McClellan from Pixels and Pills, signing off.